So in this video we are going to see about the femur or thigh bone. The word femur in Latin means thigh. So this bone is present in the region of thigh, so they named this bone as a femur bone. We simply call it as thigh bone. It is the longest bone in human body. It measures around 45 centimeter, 18 inch in length. Like other long bones, it also have two ends and shaft, but this bone is very much different from other bones. Side identification of this bone is very easy. So once you take this bone, you can easily identify the upper end and lower end. Lower end will have condyles, two condyles will be there, and upper end will have one elongated neck and a head. So once you identify the head and neck should face medially, and you have to place the head and neck medially. If you see the shaft of the femur, the shaft should be convex anteriorly and smooth. In the posterior aspect of the shaft, you will see one line, prominent line. This line is known as linea aspera. Linea aspera. This line will help you to identify the side. The head should be face medial and linea aspera should present posterior. So once if you place the bone like this, you will get the bone like this. So I have right and left side bone. So head should be face medial and linea aspera should present on the posterior aspect. The condyles will be less prominent anteriorly. The anterior aspect of the shaft will be convex. Okay. Now we will see about the upper end, lower end and the shaft. So upper end of the femur have multiple features. The reason is upper end have many important muscle attachment. So upper end, if you see, the upper end will have head, followed by head we will have neck. After the neck we have one projection. This projection is known as greater trochanterium. In the posterior aspect, if you see, another one projection will be there. This projection is known as lesser trochanterium. Greater trochanterium and lesser trochanterium. Anteriorly, this greater trochanterium will continue downward and connected with the lesser trochanterium by a line. This line is known as intertrochanteric line. Posteriorly, this line is replaced by a crest, and if you see between these two trochanterium, a depression will be there. This is trochanteric fossa. This depression is known as trochanteric fossa. So in the upper end, head, neck, true trochanterium, trochanteric line and trochanteric crest and trochlear fossa. These are the important bony features. Now we will see about the head. Head, if you notice, it is a circular one. It is 2/3 of a spherical. Followed by head we have neck. Compared to other bones, neck of the bone is so much lengthier. Neck is around 5 centimeter. If you see the head, in the center of the head, you can appreciate a small depression. So this depression, this head will articulate with the area called acetabulum. Acetabulum in the hip bone. If you notice the acetabulum also, acetabulum will have a smooth C-shaped smooth surface. In the center it will have a rough area. This C-shaped smooth surface is known as lunate fossa, because it is appearing like a semi-lunar, like a moon crescent, and rough area will be there. This rough area and this central rough area in the head have a connection. This both area, this rough area in the acetabulum and this is connected by a ligament called ligamentum foveae or round ligament of head of femur. So this is fovea centralis. From the fovea centralis, one ligament called ligament of fovea or ligament of head of femur will be attached. Okay. Now we will see the neck. Neck is broader and longer. So neck having two border and two surface. Superior border, inferior border, anterior surface and posterior surface. This neck and body, neck and the shaft will make an angle. Neck and shaft, if you place and make an angle, it make an angle of 125 degree. This angle this is called as longitudinal axis. Longitudinal axis of neck and the longitudinal axis of the shaft will make an angle of 125 degree. This 125 degree will be little lesser in female, because female usually have a wider pelvis, so their hip bone, neck and shaft angle will be little less, and this angle will be higher in children's. In case of children's, it will be up to 140 to 160. Then from head to neck, it may make an angle of 7 degree. Shaft to neck 125, head to neck 7 degree. So these angles are very important. Once this angle get disaligned due to some congenital problem or due to tuberculosis or something, it will leads to frequent dislocation and malalignment. Okay. Now this is the greater trochanterum and this is the lesser trochanterum. This is the intertrochanteric crest and trochanteric line. So this greater trochanterum and lesser trochanterum give attachment to many important muscles, especially this intertrochanteric line. If you put your finger in the intertrochanteric crest, not in the line, intertrochanteric crest, you can appreciate one tubercle. That tubercle is known as quadrate tubercle. Here one muscle called quadratus lumborum will insert. In the greater trochanterum, psoas major, psoas minor, iliacus, this muscle will insert. If you come down, we will go to, if you come down to the lower end will have two condyles. So if you see the condyles, the medial condyle will be little posterior than lateral one. Lateral one will present anterior, and this lateral one will sit, this medial and lateral condyle sit over the tibia. In between this condyle there will be a notch, there will be a gap. This is known as intercondylar notch. In case of tibia, we already seen there is a intercondylar area, intercondylar tubercular area. In case of femur, there will be a notch, intercondylar notch. Okay, so this intercondylar notch, if you see the condyle, medial and lateral condyle, the lateral condyle will be somewhat appear straight than the medial condyle. The lateral condyle will bear the most of the weight of the human body, and it will transmit the weight to the tibia. For medial condyle will be little aligned posteriorly. Okay. In the posterior, now we will see about the shaft. Shaft of this bone is little difficult to understand, because if you study about the thigh region have three group of muscles and three important structure. Anterior compartment of thigh having the extensor muscles, posterior compartment of thigh having the flexor muscles or hamstring muscles, and the medial compartment is having the adductor group of muscles. So three compartment of muscles are present around the thigh, and mainly the upper end of the thigh, upper 1/3 of the thigh is related with femoral triangle. Middle 1/3 of the thigh related with the adductor canal or subsartorial canal or Hunter's canal. Lower 1/3 is related with popliteal fossa. So three major structures are related with the different parts of the femur. So likewise, this femur bone also have, in the shaft it have some difference in the upper 1/3, middle 1/3 and lower 1/3. If you see the middle 1/3 of the femur, middle 1/3 of the femur will be somewhat round, and middle 1/3 will have three borders and three surface. So, and remaining upper 1/3 and lower 1/3 will have four border and four surfaces. Middle 1/3 will be somewhat rounder, upper and lower 1/3 will be broader and flatter. So for that reason, upper 1/3 and lower 1/3 will have four border and four surface. Middle 1/3 will have three border and three surface. So now we will see the borders. So this is the middle portion of the thigh bone. This bone having, if you see, you can appreciate a line in the posterior aspect. This is the linea aspera. This linea aspera is prominent in the middle. So it is considered as posterior border, medial border, lateral border. thigh have medial border, lateral border and posterior border. Lateral surface, medial surface and anterior surface. In the middle part, 3 surfaces and 3 border. If you see the upper end will be flatter. So upper end, medial surface, medial border, lateral border, and also we have posterior border. There is one, if you see closely, from the intertrochanteric line, one line will pass downward, one S-shaped line. This is known as spiral line. So because of this spiral line, the border is considered as 4 border. This is the anterior border, medial, lateral and posterior border. 4 border, anterior surface, medial, lateral and posterior surface. 4 surface in upper end. Because of this spiral line, the border is divided into anterior, posterior, medial and lateral. 4 surfaces also. If you come to lower end, anterior surface, medial border, lateral border, and the linea aspera which we see as the posterior border will be split into 2 lines. So these lines forming a triangular shaped area. This area is known as popliteal surface of the femur. Popliteal surface. Here only the popliteal fossa is situated, upper part of the popliteal fossa. So it have 4 surface: anterior, posterior, medial, lateral. Now if you see the linea aspera, if you appreciate the linea aspera, in the medial condyle at the end, it will form a tubercle. This tubercle is known as adductor tubercle. So this linea aspera gives attachment to all the adductor muscles. All the adductor muscle will insert in the linea aspera. Adductor magnus will insert in the linea aspera. It continues and insert up to the adductor canal. Adductor tubercle. So these are the some of the important features in the shaft and the upper and lower end of the femur.